The third coronavirus wave has unfortunately resulted in many more deaths. But how are funeral parlours coping? Dove's Group CEO Minki Rasenyalo speaks to us now. Thank you very much, Mr. Rasenyalo, for your time this morning. So we hear the numbers every day, currently an average of over 300 daily deaths nationwide. But what does that mean practically for your operations in terms of how many deceased you're taking through the burial or cremation process daily?
Okay, we've seen a surge in the number of COVID cases. Normally the winter season is when we see a high number of deaths. But this season, in most of our mortuaries, we're reaching full capacity. And 60% of those funerals that we do are COVID cases.
The numbers represent individuals, fathers, mothers, grandparents, breadwinners, somebody's son or daughter. How are you and your employees coping emotionally with the fact that you're having to provide services for so many people who've lost their lives?
It is quite scary for most of our employees, almost all of us, because in some of the regions we haven't been vaccinated yet. In Gauteng, we haven't, and we've been inquiring as to when are we going to be vaccinated. We've seen a few number of cases where our employees are now being affected.
But you have to perform the services that you offer under very strict conditions, given the nature of COVID-19. Do you have adequate PPE to do that?
We do. We do, not like the first time when the COVID started, where we had problems, but this time we were prepared, and the suppliers, they have plenty of supply, so we don't see any problems this time around.
We've seen a tightening of restrictions on the number of people able to attend funerals. How do you see families coping at the moment while they're unable to follow traditional or cultural practices during those tightened restrictions?
We do have one or two of those cases where families insist on having a number of people, a large number of people, or they will want us to take their loved one and open them at home. So with the regulation, this is restricted. So we do explain before the funeral that the full procedure on how things are going to be. If families are giving us a hard time, we always contact the SAPS.
You said that a number of your mortuaries are operating at capacity currently. We have no idea of what this third wave is likely to do, especially here in Gauteng, where the numbers are the worst. What happens when the number of deaths exceed the capacity that your facilities are able to handle?
We always have, we do have a contingency plan in place where we get refrigerated containers. But our strategy is that we do discuss with families that we should either bury on a daily basis and do cremations. We do own our crematorium, which is eNCA, Independent Crematorium for South Africa. So we do arrangements that we cremate. And then the Department of Health, they have also allowed us that our crematorium should run day and night.
And in terms of the administrative processes that follow the actual physical procedures of burial, funerals or cremations, how are you doing in terms of processing the paperwork?
The paperwork, we're finding a slight problem because doctors are working full-time with our B schedule, where the doctors, they have to sign to say what did the person what was the diagnosis, what is the cause of death. So that is the slight delay. Home Affairs, this time around, we don't have problems with the registration of death. So that does assist us in a huge way, because in the second wave, we had huge problems with the Department of Home Affairs. But this time, it's running smoothly so far.